Welcome, everybody, to today's breakout, Food Security and Ecological Analysis of Innovation and Diffusion of Policies to Address College Student Financial Insecurity in the American States. I have the pleasure of introducing today's breakout speaker, Dr. Rebecca Hagedorn-Hatfield. Dr. Hagedorn-Hatfield joined the Department of Nutrition, Health, and Human Performance in 2020. Before coming to Meredith College, Dr. Hagedorn-Hatfield served as a Postdoctoral Fellow at West Virginia University, where she conducted research on lifestyle interventions for chronic disease prevention and managed multiple United States Department of Agricultural funded research programs. Additionally, she worked as a consulting bariatric dietitian. Dr. Hagedorn-Hatfield is a member of the Society for Nutrition, Education, and Behavior, American Society for Nutrition, Academy of Nutrition and Dietetics, and American Public Health Association. She was previously a Science Policy Fellow with the American Society for Nutrition, and she currently serves as co-chair of the College Food Insecurity Subcommittee as part of the SNEB Higher Education Division. She is active as a peer reviewer for 8 scholarly journals in her field. So without further ado, I invite Dr. Rebecca to the stage to start her presentation.
So hopefully you are all able to see that. My title is slightly different than the one that Emily put in the chat. So I think Dr. Colby and I might have got our wires crossed a little bit. But I am going to talk about food insecurity specifically from the college student standpoint. We can definitely get into conversation about financial insecurities. But I would like to share a little bit about some research that has come out of the Society for Nutrition, Education, and Behavior. So as mentioned, I am at Meredith College. I'm an assistant professor, but I also serve as the chair-elect for SNEB's Higher Education Division and have spent time chairing their College Food Insecurity Subcommittee. So we're going to talk about some of the work that has come out of that today as we explore some of the initiatives on college campuses and specifically focus on kind of what keeps these initiatives from being successful and what are some things that we can look towards facilitating successful and sustaining these programs. I do not have any disclosures. So just very briefly talking about the background of food insecurity, I always know talking to those within kind of the health field or the nutrition field that typically we have a good understanding of what food insecurity is, but we're going to base this off of the United States Department of Agriculture, the USDA's definition focused around food insecurity being an economic or social condition of limited or uncertain access to adequate food. So oftentimes people think about food insecurity in very extreme forms. So we think about hunger or malnutrition. But really when we think about food insecurity, especially in the United States, a lot of it comes down to the anxiety of being able to access food. So kind of that monetary balance between can you afford food or do you have to pay for other necessities, as well as that component of adequate food. So that's adequate food to be able to live a healthy lifestyle, which oftentimes is just out of reach for certain populations. So we see this food insecurity occurring. And unfortunately, that is the reality for many Americans. We see the most recent estimate of food insecurity being 10.2% of U.S. households, or 13.5 million American households experiencing food insecurity every year. But as mentioned, we're going to focus mostly on college students. So when we talk about college student food insecurity, we see that these rates often exceed that of the national average. Now, we do take that with a grain of salt. We know that this is not as kind of broad scale of an estimate as we have from the USDA's tools, but we do have a lot of campus-based data at this point that shows us the level of prevalence on a college campus. We also have to take into account that the tools that are used are the USDA tools, but the context on a college campus might be slightly different. So with kind of those limitations, we still do see really high rates that make it an alarming issue on college campuses. The qualitative data that we have also kind of backs this issue. So even though there could be some question about kind of the accuracy of the number in terms of college food insecurity, kind of the stories or the narrative that students share really justifies kind of the issues that they're seeing on campus. So talking a little bit about that quantitative data, we see that the estimate for college food insecurity, when we look at all of those studies, typically falls somewhere in about the 40% range, or you'll commonly see about 1 in every 3 college students experiencing food insecurity. When we talk about the food insecurity, why it is such an important issue for college students is that we know they're here to learn. We know that college students come to campus with the goal of obtaining that college degree. As a society, we have pushed students in that direction. We've pushed young adults to need a college degree. At the same time, we've made college really expensive. Living conditions are really expensive. So it leaves a lot of college students in a kind of between a rock and a hard place. And that's a barrier for what they're here for. Again, that degree obtainment. So we see that food insecurity can cause lower academic achievement among students. They're more likely to drop a class. They don't feel as they're learning as well in class. And ultimately, they have a lower chance of graduating from college altogether. We see that their diet quality is poor, again, from a health or a nutrition standpoint, which I know we're all kind of concerned about. That is not what we want to see among college students. We know that college students don't have the most ideal diet quality already, and then adding food insecurity on top of that, we see kind of more diminished diet quality. And then health across the board then declines as well. So we see higher rates of mental health, poor physical health among students who are food insecure, as well as lower sleep quality. On the other side, we see increased levels of stress. We know that college is already a stressful time for students. We know that those mental health problems are prevalent. And if food insecurity is just adding another layer of stress, that's just kind of making this problem of mental health a stronger issue on campus. And then lastly, we see that these students have to rely on more coping strategies. Some of those can be healthy coping strategies. So things like making a budget, using coupons, but oftentimes it's unhealthy coping strategies as well. So relying on, larger lines of credit. So going into credit card debt. We see that students will avoid purchasing textbooks or materials that they need for class to be able to purchase food. So some of the coping strategies that can really lead to, again, poor success in higher education. So ultimately, this leaves our population of food insecure college students struggling with this really large roadblock for success. So when we talk about kind of what we do to help these students, we can think about it on multiple different levels. So there's a lot of movement to help college students. This is an issue that has been brought to attention at the federal level. We do know that the GAO put out a report regarding college food insecurity, and that it was something that during the COVID pandemic was on the radar of the administration. So thinking kind of broadly at the federal level for food insecurity, we know that the Supplemental Nutrition Assistance Program, or SNAP, is the kind of strongest safety net for individuals who are facing food insecurity. But historically, college students have faced eligibility barriers when it comes to enrolling in the SNAP program. During COVID, we did see some expansion for college students, essentially making it a little bit easier for them to enroll in the program as long as they met 2 criteria. So we did have some movement at the federal level. There's also been a couple bills introduced to help college students, and we'll talk about those just a little bit more at the end. On the state level, we also see hunger-free campus bills. So we can look at some of those states that are specifically putting state funding towards making sure that college students have some outreach for SNAP enrollment, because we know students oftentimes aren't aware of the program or don't understand the process of enrolling in the SNAP program, but as well as making sure that there are other resources on campus, which leads us down to that university level response, where those campus initiatives can be really important as kind of a downstream solution for students. So upstream, thinking about those policy solutions that are going to kind of target the source. So that's kind of that federal on that state approach. Downstream, though, we know that policy takes a long time. So we need to make sure that we have initiatives in place for students that are struggling currently. And that's where our campus initiatives really come in. So when we think about that university level response, there's a lot of different programs that are out there. I know earlier you heard from Dr. Brown, and I'm going to talk just briefly about her paper as well, but she probably talked about a lot of these initiatives. And we know that there are, food pantries on campus, kind of the leading initiative that we see, but a lot of other initiatives being pushed as well. So meal swipe programs, gardens on campus, free farmers markets. Some institutions are using their learning platforms to help connect students to free food on campus. Nutrition education is a component that is being wrapped into food insecurity work, as well as kind of taking a look at food insecurity and thinking of it in kind of the larger context of basic need insecurity across the board. So a lot of institutions are taking this kind of more one-stop shop approach of having basic needs hubs. So we know that these programs exist. There's a lot of great literature on them. There's a lot of media attention that will come around these type programs, which led me during my dissertation to develop a toolkit to try to help other campuses implement these type programs. So I created, in conjunction with the Lifestyle Intervention Research Lab, led by Dr. Melissa Olfert, the Wish for Campus Toolkit that was essentially designed to help somebody who maybe works at a campus where they don't have a food insecurity initiative, and kind of give them a place to start. So show them what other campuses are doing, allow them to connect with those other campuses, understand how to measure food insecurity on campus. But ultimately, this was just kind of one additional piece to the literature, but still we're seeing kind of a lack in peer-reviewed literature around these initiatives. And that was kind of what came out of the paper by Hickey et al., led by Dr. Brown's group as well, that kind of looked at a systematic review of these initiatives and kind of what they're intending to do. There was only 8 papers included in that study, because ultimately we don't have a lot of data showing us that these initiatives are successful, showing us what kind of keeps these initiatives from sustaining, so on and so forth. But this was an incredibly valuable paper to add to the literature that can show us that adding these initiatives on campus can help improve some of those kind of barriers that we talked about food insecure students facing. So it can help to improve diet quality. We can prevent food waste and get that wasted food in the hands of students who need it. Minimizing stigma, that is a barrier for a lot of students to access resources, helping them with that SNAP enrollment. And then ultimately that large outcome, again, why students come to college is to graduate. So can these programs make our food insecure students more successful, kind of help them achieve food security so that they can stay on campus? But I talked a good bit there about kind of just the overall limitations that we have on this topic. So again, there's not a lot of peer-reviewed literature. And this was kind of a talking point that we threw around a lot within the Society for Nutrition, Education, and Behavior. The subcommittee that I led was the Food Insecurity and Higher Education Subcommittee. That's part of the Higher Education Division. And we talked a lot about, what do we want to do as a group? We are spread across the United States, as well as a couple colleagues who are in the United States territories, and kind of what was our goal? What did we want to get out of this group? We know that there's a lot of prevalence data at this point. We know that there's a lot of data showing us kind of risk factors for food insecurity. So, what are those groups that, maybe we need to provide a little bit more support for. But really, our conversation came down to how we help other higher education institutions to implement programs that are successful. So we set forth with two goals in the 2020-2021 year that we wanted to evaluate these campus resources. Again, there's not a lot of literature out there. So we wanted to kind of see what campuses were doing, and we wanted to see what was making their initiatives successful. Our goal with that was to then be able to kind of disseminate some best practices to help campuses kind of support the programs that they have and make sure that they can sustain, make sure that they can expand to reach the students in need. So that was kind of the purpose of the study that we have here. Again, little is really known about these programs. So we were specifically interested in looking at, how these programs operate. So who's leading these programs on campus? How are they funded? Is it something where students are involved? Is there any kind of evaluation that is going on these initiatives? And if so, what is that evaluation? So ultimately, our purpose was to describe these initiatives, and then we wanted to investigate those barriers and facilitators so that we could then put forth some best practices to kind of overcome those barriers on campus. So we used a convenient sample of higher education professionals. We specifically recruited individuals who had experience working with college food insecurity. So that was one of our eligibility criteria, that individuals needed to have experience on campus working with either food insecure students or working with these initiatives specifically. We recruited, starting off with listservs from SNEB, the Society of Nutrition, Education, and Behavior, and then really just used a snowballing method from there. We used social media resources, so we put word out on Twitter as well as LinkedIn that we were looking for individuals in this space, as well as word of mouth. So sending it to colleagues that we knew that were doing this work. And we did use an incentive, one of 4 $25 gift cards to try to recruit individuals. We collected our data using an online cross-sectional survey. It was 23 items, and I'll show you what specifically we captured. But ultimately, that survey was developed by the members of the SNEB Higher Ed Subcommittee. Spent a lot of time going back and forth to be able to answer those research questions that we put forth. And then we sent this survey out via Qualtrics. So specifically our survey, we collected demographics. One of the individual who was responding to the survey, but also demographics of their campus as well. Then we asked them about the campus initiatives that were available, including how they were led, how they were evaluated, as well as how they are funded. And we asked those questions for each initiative that they shared was on campus. So for example, if they said they had a food pantry, they were asked how the food pantry was funded, led, and evaluated. If they stated that they had a farmer's market, they were asked those same 3 questions. We also asked if COVID impacted the implementation of these programs on campus, and if so, they were able to give us a little bit of context about what changed. And then our biggest point, we wanted to know about those barriers and those facilitators. So we asked those specifically if they had been involved in the implementation. And individuals who responded yes, that they had been involved in implementation, were able to give us more details about the barriers that they faced when trying to implement these initiatives on campus, as well as what they found to be, successful for them. What are those facilitators that they need to make sure that their program continued on campus? We did descriptive statistics for the quantitative data. We also did a little bit of inferential statistics. So we did Pearson chi-square and Fisher's exact test, looking at barriers between private and public colleges. So wanted to see if there was increased likelihood of different types of barriers depending on the type of campus that somebody was on. And then for our open-ended data or qualitative data, that was independently coded by 2 researchers, and they came together and decided on overarching themes. So for our survey as a whole, we had 108 respondents. They were from 33 states across the United States. And when we looked at kind of their perception of food insecurity, 40% of them found that on their campus, they thought that food insecurity was severe or very severe on their campus. If we add somewhat severe into that, that goes up to almost 90% of respondents saying that food insecurity was at least somewhat severe on their campus. Looking at some of the other demographics that we have there, you can see that most of our respondents were coming from schools in either the West or the South. We had a pretty decent split between rural, suburban, and urban. A majority of our campuses were public institutions. A majority were 4-year institutions. And then we had a pretty decent split between survey respondents that were administrators, faculty, and staff, with a small amount of students who did respond to leading these initiatives. So when we look at the initiatives that are available on campus, 95% of those who responded to our survey stated that they have at least one campus food insecurity initiative. Of those initiatives, food pantries were the most common. So that is something that we typically see in the literature, but you can see of those who had initiatives, 98% of them had a food pantry. So a very common initiative that we see on campus. We also see that some of these other initiatives are common on campus. So we see things like meal swipe programs or different dining assistance programs being close as to about 50% of campuses having them. Gardens, very similar, about 50% of campuses had a garden as well. We did have this other category, which included things like nutrition education, SNAP outreach, meal kits, cooking classes, food recovery programs, where these campuses were telling us kind of what those programs were. We also asked about kind of that leadership, and we're going to get in that a little bit deeper in terms of where that leadership lies on campus. But when they were describing their programs, they were able to describe to us if those programs were student-led. And we see that there are some programs that are more often student-led than others. So for example, things like mobile application programs or gardens, pantries are often student-led, whereas other programs such as like the dining programs on campus or farmers markets on campus seem to be less common in terms of having that student leadership. And then in terms of the impact of COVID, a majority of respondents did say that there were a change to these programs on campus, and specifically a change in how they were implemented due to COVID-19. This was an open-ended question that followed, so they were able to say yes or no. There were changes, and then they had an open-ended question. And that qualitative data was coded into 2 themes, 1, modified operations, and 2, new initiatives. So very commonly during the COVID-19 pandemic, we saw that a lot of these food insecurity initiatives really had to change how they were, operating, because there were social distancing requirements. Students were no longer on campus the way that they were. So there were a lot of different changes that happened. Some of the things that we found under modified operations included things like changing the hours that the food pantry or other food resource was open, limiting visitation. So, only a limited number of students could be in at a time. Appointments were something that was mentioned a couple times, as well as the programs ultimately being closed as well. All of that to say, there was less access to these food insecurity resources during COVID. So whereas oftentimes these resources are open anytime that, staff might be on campus, or even, if there's card swipes for them to get in if students are around. A lot of those things changed during COVID, which made it a barrier for students to be able to access these programs. But on the other side, we see that a lot of campuses took this as an opportunity to be creative. So although programs had to change in how they were operating, they used it as a time to try out new ways to reach students. And these new initiatives were broken down into both tech-based initiatives or non-tech-based. So we think of tech-based in terms of using online ordering programs. Some respondents talked about using delivery apps, so allowing students to place orders through things like Harris Teeter or Walmart, and those foods being delivered, as well as using kind of virtual ways to provide resources to students, such as providing just gift cards instead of them being able to come into the food pantry. Non-tech based really played off that need for social distancing. So doing things like curbside pickup, donations being dropped off to individuals, or even excess resources being dropped off to community partners, as well as some different grant programs. When we asked about leadership, we saw a lot of variability in terms of who was leading these different initiatives on campus. But the most common place where we saw leadership being housed was in an Office of Student Life. Now that name might differ from campus to campus, but that was kind of the area where most respondents were telling us that their initiatives were housed. So you can see 46% of food pantries had leadership in the Office of Student Life, 41% of meal programs, 53% of dining programs, 33% of mobile programs, and so on. In terms of gardens and farmers markets, we saw that faculty and staff were more responsible for those programs compared to the Office of Student Life. So more of that leadership falling there. But what you see also is those aren't high percentages of the leadership responsibility falling into, the Office of Student Life or within faculty and staff, because more commonly what we saw was a shared responsibility. So respondents were able to select more than one option, and very commonly they did that. So oftentimes we saw that our programs were having shared responsibility between something like the Office of Student Life and faculty and staff, or the Office of Student Life and students. So a lot of these programs did have more than two parties that were involved in the leadership on campus. And I also take you back to that point where we looked at the initiatives and you saw that there was a lot of student leadership. So although student leadership is not part of this shared responsibility that they were answering, they had answered a separate question about student leadership. So students were really involved. So we see kind of this effort that is spread kind of across campus, where it's 2 or 3 different parties working together to make sure that these initiatives are running. In terms of evaluation, 70% of the respondents shared that they did evaluate their initiatives for impact. The food pantry was the most common program that was evaluated. So you see 61% of those who did evaluated their food pantries, with other programs like the Meal Swipe program also being pretty common to be evaluated. Where we saw a lot of variability was in how they described that evaluation to us. So we did provide an open-ended question where they could tell us how they evaluated. So we saw, again, some variability there, that they were evaluating using surveys. They might be tracking the number of users that are coming in or the number of meals served, as well as measuring the amount of food that's donated or distributed. For a campus garden or a farmer's market, it might be how much is produced and distributed. We also saw a lot of response there about uncertainty. So you see that bottom row focusing on the respondents that were uncertain. So a lot of them talked about knowing that there is an evaluation that occurs, but not really knowing what that evaluation looks like. So an area where we just don't have as clear of an idea of kind of what's going on. In terms of funding, 39%, only 39% of respondents stated that there is an allocated budget on their campus for food insecurity. So that's kind of coming top down. So is there kind of a pot of money that is set aside specifically to tackle food insecurity related issues on campus? Not a lot of campuses responded that occurred, but we also had some uncertainty there as well, where individuals stated that they're not really sure if there was an allocated budget to that. More so, they were trying to rely on some of their internal mechanisms within their departments to be able to fund their initiatives. So internal mechanisms were the most common funding source that was provided across programs, as well as community funding sources being the second most common. But just like we saw with leadership, we see some creativity here of finding money in different places. So where we were pooling leaders to drive these programs from different areas of campus. We're also seeing that in terms of funding, that many of these programs were using 2 or more funding sources to be able to sustain their program. So everything that I've presented to you to this point is published within this paper that was published in the Nutrition Bulletin. It is open access, so if you are interested, you are welcome to kind of dig deeper in that paper, but I'm also happy at the end to take questions. But I want to kind of continue with those 2 biggest points that I brought up as kind of our goals. We wanted to know those barriers, and we wanted to know what those facilitators are to make these programs successful. So this was specifically directed as a question to individuals who said that they have experience implementing programs. So while we had 108 respondents to the survey altogether, only 65 of those respondents were directly involved in the actual planning and implementation of programs on campus. So moving forward, we are only using those 65 individuals who really have that lived experience to be able to tell us, what doesn't work on campus and what really does work. So of those 65 individuals who had experience with planning and implementation, 97% of them reported that they experienced barriers when they were trying to implement a program on campus. Any of you that have experience implementing programs on campus can probably attest that that is going to be the case. You're always going to hit some road bumps, but it's important to kind of share what those road bumps might look like, as well as, what are some things that we can do to overcome those barriers. We found that on average, they faced 3.7 barriers to implementation. Those barriers included things such as funding, marketing and student awareness, stigma, access to the location, inconvenient hours of operation, competing initiatives on campus, difficulty finding volunteers, as well as no demonstrated need. So when it came down to that 3.7 as an average, they were listing multiple of these as being the barriers that they were facing. With that, funding and marketing and student awareness were the 2 largest barriers that individuals reported facing on their campus, followed by stigma, as well as some of those accessibility issues, such as the hours not being convenient or the access to the location not being appropriate. We also had this other group, which included things like COVID-19 operational challenges. So the fact that, their program just wasn't able to sustain on campus during the pandemic, or they weren't able to kind of expand the way that they wanted to. Lack of institutional support or acknowledgement. We did have some shared responses that individuals felt on their campus that administration just didn't want to acknowledge that this was a problem because they don't want that as kind of the perception of their campus. Well, if you go there, there's an issue of food insecurity. We know that that's not the case. There's no institution that is immune from this issue, but some campuses are less willing to kind of acknowledge, which makes it much harder to then implement programs to support students. Student perceptions of needs. Specifically, we saw that respondents were sharing that students perceived that other people needed the resources more than them. That is something that has been published in the literature previously, where we really need to get students to understand that, yes, there might be somebody who needs it more, but if you need it too, that's what that resource is there for. So we don't need to compare ourselves to somebody else in terms of using resources. If you need a resource, that's what that resource is there for. But that student perception was a barrier. And then lastly, lack of consensus or coordination kind of across campus, especially across different programs. So when we looked at some of these programs, let's say the food pantry, the farmer's market, the garden, we saw that leadership varied between those groups, and that coordination between those groups was considered a barrier. So there's a lot of things going on regarding these issues on campus, but that working together is something that was reported as being a barrier. When we looked at barriers by campus type, there was no observed differences in the total number of barriers. So we didn't see that, public institutions faced more barriers than private institutions, but we did see some slight differences between those at public and private institutions in terms of those who are at public institutions were more likely to have trouble with some of the accessibility issues. So in terms of accessing those food insecurity initiatives, we saw that public institutions faced more challenges in terms of finding volunteers, as well as public institutions facing more challenges regarding the stigma issue on campus. So just giving a little bit of context that some of these larger institutions, it might be a little bit harder to make the initiatives accessible to everyone versus a smaller private campus. It's oftentimes, hard to overcome an entire kind of cultural change on a large public institution. That doesn't mean that we shouldn't work towards that, however. So we want to think about some of these issues on public campuses and make sure that we are considering that these are additional challenges there. But the biggest part then, so we know that there are barriers, so what do we do about it? What are those things that those that have been successful find that works for them? Because those are the things that we want to share. We want to share those facilitators with other campuses that are trying to expand their programs, trying to add new programs, or ultimately trying to just get any program off its feet. So our open-ended questions regarding facilitators were coded into 3 different themes: campus culture, resources and operations, as well as data collection. So when we talked about campus culture, what we found is that institutional support, as well as support from faculty and staff, was something that was talked about a lot by our participants. What you see as italic here are all quotes from participants. So I think the one about institutional support gives you a really good idea. So this is institutional support, not just in terms of providing money, but overall a buy-in that these programs are important, that these programs are valuable, and that you acknowledge that this issue exists on campus, and we want to build a culture that is going to support these students. Awareness and marketing, we talked about that as being a large barrier, and individuals reported that if you have good awareness and marketing, they see that as being a successful factor that can help with sustaining these programs. And that's a challenge. How do we get broad awareness among students? Oftentimes we saw in the responses that social media was talked about. We know that this generation of students is pretty engaged in social media. So using that as a way to, one, make sure that students are aware, make sure that you kind of use marketing tactics that, engage students. That's a great way for cross-campus collaboration. So working with some of those marketing departments on campus to kind of help you with your food insecurity initiatives and get that word out. Student engagement was another piece of kind of building this successful campus culture. So we talked about the fact that students are involved in leading these initiatives. They are a vital part of these initiatives. But ultimately, students know what students need. So working closely with students so that they can make sure that the program is really meeting the target audience. They're the best advocates for the program. They're the ones that can share with their peers really well. So it is really important that students are involved. And then lastly, we want to work towards limiting stigma on campus and making sure that we're inclusive. Oftentimes we see this kind of push and pull between where do we put these initiatives on campus. Historically, we always thought about, okay, put them in a really private place so that students can access them without somebody seeing them. But then that leads to kind of those additional challenges. Well, then they're hidden, they're way, out of students' sight. They might be less aware. It might be a bigger issue of trying to, go to that location. So then on the other end, we have new kind of push to make it more visible. But when you make it more visible, you do have some students that don't want to be seen. So it is a balancing act. How do we kind of limit that stigma and make it just normalized on campus that these resources are here and we want students to use them? And also with that, we want to make sure that we're inclusive to all students. So oftentimes when we think about donation lists for things like food pantries, they're not really inclusive of all cultural foods. We also know that oftentimes international students report that they don't feel as welcome at the food pantry. So we want to make sure that we are making these spaces inclusive to all students. ADA requirements are something else that we can think about building a healthy campus culture. So making sure that your pantry is set up for students who might have a disability, not being able to, reach really high, not maybe able to open cabinet doors, things along those lines. We want to make sure that our spaces are set up to meet all student needs. In terms of resources and operations, consistent funding was talked about by multiple different participants. So if you remember, funding was the largest barrier, and that was, came up again and again in terms of if we are going to make these programs successful and sustained on campus, we have to have consistent funding. I like this participant quote that, it takes a lot more funding than you would think, and that growth each semester has been higher than you would think. And I can actually live that in my personal experience here on my campus. We just started a satellite food pantry. So we have a main food pantry, but we started a satellite hub, and we have seen increased growth in use each month, which means that we have to get more food each month. So it has taken, more money than we thought. And this participant kind of lived that same experience. So having consistent support from the campus in terms of providing that funding, making sure that potential donors are aware that it is an option to donate towards these initiatives on campus is really important. Dedicated staff is something that was mentioned a lot as well as that coordination of the effort. One of the things that we saw under this dedicated staff component is that student leadership is important, as we talked about on the campus culture, but we also know that there's turnover of students. So students aren't going to be with us here on campus forever. So it is important to kind of have that individual in place that can manage when there is turnover. We also know that there's a lot of bureaucracy issues on college campuses, and you need that individual that can help navigate those issues, not just putting that on the plate of a student where they might struggle to figure that out. But then ultimately that coordination as well. So again, there are multiple different programs going on campus. So we want to make sure that the individuals that are leading those different initiatives are working together, because ultimately we do have one large goal, and that is to limit food insecurity on college campuses. We want this hunger-free campus, and to do that, we really need a coordinated effort where all of these individuals are working together. They might be leading their individual programs, but ultimately we are kind of talking to one another. We have a collective approach in terms of how we are tackling this issue on campus. Accessible and welcome spaces. So again, kind of those ADA issues. We want to make sure that students know that these spaces are, open to them. They are welcome to come there. Kind of friendly faculty and staff or student workers are a great way to make students feel comfortable going into a space. And then lastly, volunteer support is something that was mentioned as being a necessary component, especially when we think about things like running food drives, farmers markets on campus, harvesting produce from gardens, all things that require kind of all hands on deck, and having that volunteer support is important. But I liked what this participant said as well, that it's important that those volunteers understand the importance of food insecurity as well. Oftentimes in the higher education setting, we're recruiting students, we're recruiting who we can get. And oftentimes you can get a student that maybe doesn't have background in food insecurity, or they might not understand kind of the sensitivities that go along with food insecurity. So just some brief explanation, making sure that your volunteers kind of understand the importance of this topic. And then lastly, data collection. So needs assessment was something that participants reported as being important. That's a great way to show your administration kind of the magnitude of this issue on campus and just kind of how impactful it is on students. But this participant talked about the fact that they need a more systematic approach, not something that is just piecemealed from campus to campus. And that's not something that we currently have. We don't have this kind of one pretty picture of college food insecurity. We don't have this one approach that is used across campuses that we can then compare. So moving forward, we do need a better way to kind of quantify this issue on campuses and help students to be able to understand the resources that are available to them. So they talked about that as well in terms of resources for research, specifically talking about there needs to be kind of funding, partnerships within departments to kind of help address these issues on campus. And then lastly, that outcome data. So as I mentioned, Dr. Brown and her group had published that systematic review on food insecurity initiatives and what those outcomes look like. And those outcomes kind of vary between each different kind of paper that's published. So we kind of need a more consistent outcome measure. And a lot of these participants specifically talked about outcomes regarding retention and graduation rates. So are these programs that we're putting in helping students to be successful in the long term? But we also had some participants that talked about specifically measuring outcomes regarding food insecurity. So if we're putting forth programs that are going to help tackle food insecurity, we need to measure it to see if it is actually doing that. So evaluating these programs to see if it is actually causing a decline in that food insecurity rate on campus. So in conclusion, these programs are available. So again, we had 108 respondents, and a majority of those respondents said that they have at least one program on their campus. So there are programs that are being implemented, but in terms of the type of program, the funding, the leadership, and the evaluation, that varies greatly from campus to campus. And that's something that is expected. Each campus is unique, and how they go about running these programs on campus, is always going to be unique to campus. But what's not unique is that they were all facing pretty similar barriers. There's a lot of barriers that they mentioned that were, keeping these campus-based initiatives from reaching their full potential, reaching all the students that need support from these initiatives. And ultimately, those are the barriers that we need to address. So things like funding and marketing and stigma. And to do that, they talked about the fact that we just really need a campus culture that promotes this environment of food security. And we do that through sustained funding and support from administration and stakeholders to make sure that we can drive this campus culture change. So moving forward, I just want to kind of take you back to that multi-level approach. So what do we do about this issue? Well, there are a lot of different kind of approaches that we can take, and it's important that we think about kind of moving the needle forward at all levels. So from the federal level, that SNAP expansion that I briefly mentioned is not permanent. It is only in place during the public health emergency that was caused by the COVID-19 pandemic. So there's a push to make that expansion permanent. So that is something that the USDA, specifically the Food and Nutrition Service, has been kind of pushed. There's an advocacy effort to kind of push that expansion, permanent expansion. But there's also bills within the current legislation to help expand access for college students. So that can include expansion for things like SNAP, changing kind of what work means. So being a college student being defined as work, as well as expanding things like work study opportunities. At the state level, there have been some states that are really successful with those hunger-free campus bills. California is a great example of that. Oregon, Illinois, New Jersey, states where we have seen some kind of movement in terms of these hunger-free campus bills. But ultimately, we have to expand that into other states. So while we kind of wait for this federal push, we need to kind of get the ball rolling at the state level. So expanding those advocacy efforts throughout multiple states is something that we can push towards. And then lastly, at that campus level or that university level, again, these programs are vital. Policy is slow. So we're going to work towards upstream solutions, but we have to think about making our downstream solutions more successful, more sustainable on campus. And what we really found was the fact that it just needs to be a culture on campus that allows that to be the case. So a more coordinated campus-specific approach is something that we can all kind of strive for on campus. We all come to these type conferences to get good ideas and to work together. But oftentimes we're not working together with those on campus who have same kind of motivations as we do. So we want to think about finding those people on campus, find those that are doing similar work, and drive this coordinated effort on campus, ultimately with the support of that administration as well. I would just like to briefly acknowledge the partners of the higher ed, the Food Insecurity and Higher Ed Subcommittee. So they are listed there. I also will mention I'm no longer the co-chair of that subcommittee, but the co-chair is listed here. So if you are interested in joining that subcommittee, you can send Dr. Soot an email, and you can kind of join some of the work that we are doing. And then I also acknowledge the Higher Education Division for their funding. And with that, I'm happy to take any questions that you all might have.
Thank you so much. We did get a question in the chat. Morgan asked, do you think the current food insecurity tools accurately measure food insecurity on college campuses?
I would say yes and no. I think they give us a decent idea, but I don't think that college students perceive those questions in the same way as they were intended to. I'll give you an example of that. When we look at taking the kind of 10-item USDA food security screener, and it has been shortened into 2 items as the hunger vital sign. And what they did to shorten that tool was they looked at the questions that were most commonly answered affirmatively. So what were those 2 questions that were most respondents were saying, yes, I am facing this kind of food insecurity symptom. When we compare what those questions were affirmatively to the general public, so the questions that helped to make that screener, when we look at those 2 questions in college students, they answered 2 different questions affirmatively. So specifically, we see that college students, the question that they most commonly state regarding food insecurity is that they just can't afford to eat a balanced diet. So that is slightly different than what we're seeing from the general public. But again, I do think that they give us a decent idea. So I don't think we're kind of way off track, but I do think these tools could be a little bit more accurate for college students. And there is some work that is occurring. I know a couple of my colleagues are kind of working on this nationally to hopefully have a tool that is more specific to college students. But I also go back to that point about kind of some of the qualitative data, that the qualitative work with college students really stands behind what that kind of quantitative data is showing us. The stories from students back that they are struggling with food security.
Thank you. Any other questions before we wrap this session up? You can pop them in the chat or the Q&A tab. I'm not seeing anything, but if you don't mind putting your email, if anybody wants to reach out afterwards so that they can ask you a question or they can visit you at a table later. But thank you so much for this presentation. Thank you, everybody, for joining this session.